my name is Tasha, and I'm going to be performing the skills video today, which is going to be the head-to-toe assessment. I'm going to begin this assessment by entering our patient's room. I'm going to close the door behind me for patient privacy. I will make sure that I perform hand hygiene. I will introduce myself to the patient. Hi, my name is Tasha. I'm going to be your nurse today. Okay. Can you please provide me with your first and last name and your date of birth?
Adia Gibson, 3/21/74.
Thank you. May I look at your wristband? Perfect. Everything matches. At this time, the patient is who she says that she is, and I'm now going to let the patient know what we're going to be doing today. All right, Adia, I am going to be performing a head-to-toe assessment on you. Meanwhile, I've already performed my hand hygiene, so now I'm going to add on my gloves. What this is going to entail is I'm going to be expecting you from the top of your head down to your toes.
Okay.
Do I have your consent to perform this assessment?
Yes.
Perfect. All right. Just from looking at my patient, I do see that she's not in any distress. She is well groomed and she's sitting comfortably at this time. And I would typically take the patient's vitals as we're sitting here. Currently, my patient's vitals, her blood pressure is going to be 126/84. Her heart rate is 76 beats a minute. Her temperature is 98.6 Fahrenheit. Her oxygen is 99% at room air at this time. Adia, are you having any pain currently?
No pain.
Perfect. Patient denies any pain. I am going to start by looking at the patient's hair, so I'm going to let the patient know. I'm going to look at your hair now, okay? Thoroughly. Okay, hair appears evenly distributed. I don't see any signs of infestation. Next, I'm going to test your hydration levels, okay? By doing this, I'm going to pinch your neck. It shouldn't hurt at all.
Okay.
Okay. All right. Patient's skin trigger is non-tenting. Now I'm going to check her skin. Can you lean forward just a little bit for me? Perfect. All right. Now may I come down here and look at your arms? Thank you. All right, and I can look at your legs as well. Thank you. Turn your legs this way. Perfect, thank you. After checking the patient's skin, it does appear dry and warm and does not seem to be any abrasions or any wounds. Her bony promises don't appear to have any skin or any breakdown at all. All right, now I'm going to look at your face. Is that okay? Perfect. All right, I am going to start by looking at your eyes. As I look at you, your eyes do appear symmetrical. All right, I'm going to pull down your eyelids as well. All right. Sclera looks white bilaterally. I'm now going to shine a light into your eyes, okay?
Okay.
Please look at me as I do so.
Okay.
Perfect. Without moving your head, I'm going to also have you follow my pen, okay?
Okay.
All right. Perfect. Thank you. All right, you are doing great today. My patient's pupils are equal, round, reactive to light, and accommodation. Next, I'm going to look at your nose, and by doing so, I'm going to shine my light up there. Perfect. Thank you. Patient's nose appears symmetrical. I'm going to gently palpate your face. Is that okay with you? All right, my patient's sinuses do not appear to be inflamed or swollen. All right. And her nose did look moist, intact, and her septum is midline as well. All right, can I just have you breathe in and out of one nostril? All right, let's do the same thing for the next one. Perfect. All right, awesome. Thank you so much. My patient's nares appear to be patent. I'm also going to look at your lips. Perfect. Thank you so much. Your lips are moist and intact. Okay. Now I'm going to look at your mouth. Can you go ahead and open for me? All right. Teeth are intact. Oral and buccal mucosa are intact and moist. Patient's palate is upwardly movable. All right. I'm going to look at your ears next. Is that okay? I'm going to start on your left side. Okay, perfect. I'm going to look at your other side. All right, thank you. Ears are intact and there doesn't appear to be any drainage. All right, Adia, now I'm going to gently palpate your lymph nodes. This is going to be at your neck, okay? Go ahead and put your head straight. Thank you. Okay, lymph nodes do not appear to be swollen or inflamed. All right, next I'm going to examine your trachea, which is going to be midline here. All right, perfect. So next is going to be the jugular vein. So I'm going to look at it here. Go ahead. There you go. Turn the other way. Thank you. There's no distension and nothing is present. All right, I'm going to have you move your neck around. So what I have you do first is go ahead and look up, and then look down, and then look to your right, and then look to your left. Thank you so much. My patient has full range of motion in her neck. All right, so now I'm going to move on to your lungs. Okay. I'm going to listen to them. Do you mind if is that okay?
Sure.
All right, go ahead and breathe normally for me. I'm going to listen to your lungs from the front and to the back, which is going to be anterior and posterior. Okay, can you go ahead and sit up for me and do the same thing on your back? Thank you. The patient's lungs are clear in all lobes and there are no adventitious sounds or noises. Just visualizing my patient, she does not appear to have any labored breathing. All right, so currently right now I do notice that the patient's rise and fall is symmetrical. And there is no accessory muscles used noted at all. All right, so I'm going to listen to your heart now. Is that okay as well? Thank you. The heart rate and rhythm are regular. Next, I'm going to feel your pulses, and this is going to be on your wrist. So I just need you to relax them out for me, okay? All right, perfect. Thank you. All right. Your radial pulses are +2 bilaterally. All right, so go ahead and put your feet together for me. All right, I'm going to feel your dorsalis pedal pulse, okay? All right, thank you. Perfect, thank you. Pedal pulses are +2 bilaterally as well. All right, go ahead and put your hands out for me. Actually, I'm going to move this out of the way so I can get this out. Okay. And we'll sit here first, all right? And go ahead and put your hands out for me. I'm going to check your capillary refill on your fingers, okay? I'm just going to squeeze your fingertips. Perfect. Capillary is less than 3 seconds. All right, now I'm going to pinch your toes. Okay. Lower extremity capillary refill is also less than 3 seconds as well. All right. Next, I'm going to look at your abdominal area. All right. Go ahead and sit back for me. As looking at my patient, I do visualize that her abdomen is not distended. Okay. I'm going to listen to your bowel sounds now, okay? Patient's bowel sounds are active in all 4 quadrants. Now I'm going to palpate your abdomen. Will you let me know if there's any pain?
Mm-hmm.
All right. Perfect. All quadrants are soft and non-tender. Can you let me know when your last bowel movement was?
This morning.
Perfect. Are you having any problems with bowel movements or any trouble urinating?
No problems.
All right. Now I'm going to have you sit up here on the bed. All right. And I am going to assess your range of motion, okay? All right. Perfect. I'm going to move some of this stuff out of the way here. Get the camera going. Thank you so much. All right. Go ahead and put your arms out for me. Thank you. All right, lift them up a little more. And now, perfect. All right, now I'm going to have you rotate them. Thank you. All right, now push them this way. All right, don't let me push you, okay?
Okay.
All right. Perfect, thank you. Patient has full range of motion and strength bilaterally in her upper extremity. All right, so next I'm gonna do the same thing in your legs, okay?
Okay.
I'd like you to bring one leg in front of you and then the other one. All right, and I'm gonna push down, okay?
Okay.
Perfect. All right. My patient has full range of motion and strength bilaterally in her lower extremities. Thank you. All right, you are doing awesome. All right, so now just lift your feet up slightly for me. Move your ankles up and down and circle them around. All right, now I'm going to put them together. Okay, I'm going to push down, okay? Perfect. Ankles, full range of motion and strength bilaterally as well. Can you stand up for me? Thank you. Can you please lean over and touch your toes? All right. I'm going to stand back up. All right, I'm going to push on your chest. Can you not let me?
Okay.
All right. Perfect. Patient has full range of motion and strength in her back. Can you take a couple steps forward for me? Thank you. And back. All right. Assessing my patient walk, her gait appears to have good center of gravity. Her coordination is steady and well balanced. Can you tell me your name?
Adia Gibson.
Thank you. And where are you today?
At the hospital.
Do you happen to know what month it is?
November.
Perfect. After speaking with my patient, she is alert and oriented ×3. If I were to rate her on the Glasgow Coma Scale, she would be at a 15, meaning that her response is verbal and her motor responses are fully intact. All right, I am now finished with my head-to-toe assessment. Thank you so much. Are you comfortable?
Yes, I am.
All right, you can either sit down or lay down. Patient states she is comfortable at this time. I am also going to remove my gloves. I'm going to perform hand hygiene upon exiting the room. I've confirmed my patient is comfortable now. I'm going to exit, leave, and document all of my findings. Thank you.